Well, good evening, everyone. This is Dr. Ellithorpe with Tustin Longevity Center. I was having a little bit of a glitch on the computer, so I got a minute or two delayed. But this is from Tustin Longevity Center here in Southern California. We do this every week, Tuesdays at 6 o'clock to 7 o'clock. This is for information and educational purposes only. It's not to manage any individual patient or person sending us email questions or on the live chat. You can send us an email question by getting on tlcdoctors.com. That's tlcdoctors.com. And then there you'll get on our newsletter, and then you'll get notification of every week of our TLC Doctors Ask the Doctor Anything. You'll see a link there. You can type in on the link the question you have. So the other way is if you are on YouTube, you can type into the live question, and I will try and get to the live questions first. Then I'll go to our email questions. We're starting to get some live questions first. Once again, this is educational, not specific, but as you answer or ask your questions, I will give you my general response for the topic, not any personal advice. If you are our patient, please contact us. Call the office 714-544-1521. So today we're starting to get some questions in early. The first is from Tiziana. Hi, Tiziana. It's good to see you. She says, hi, Dr. E. If you find out that you are sensitive to cow's milk products, can you still have raw cow's milk products, or best to avoid it altogether? Well, in general, the homogenization and pasteurization of dairy has heated it up and shook up the heated dairy products so much so that it rips apart the proteins and the fats and the sugars so that the cream and fats can't float to the top anymore. So it really isn't dairy anymore. So when you buy any typical American product that they label as dairy, I actually say it's not dairy anymore. It's a foreign product. Um, and it may have been from the cow, but once they cooked it and shook it up and it's no longer behaving like normal milk from the teat of a cow or its udder, then it's not dairy anymore. So this ripping up of molecules and heating it makes the signatures of these molecules that your immune system is supposed to feel and look at and find as safe or not safe become extremely gargoyle and disrupted three-dimensional configurations, no longer recognizable, and your immune system goes on alert. That would happen to any food. If we took peanuts and we heated them up and then we shook them up and chopped them up and destroyed the molecular structure of the peanut, there'd be enough there that you would still taste the peanut, but it would make your body react to it because it's now in a much higher percentage of damaged cells. So my general answer is I think most Americans, or those who have lived in America and used American products that they thought were dairy, they were actually inflammatory white liquid and inflammatory cheese bricks, and they inflamed the body, and then you made antibodies to them. So you're not really allergic to dairy. You're allergic to the damaged process they put it through. There's casein, there's whey, there's the lactose. So there's various components inside of the food product called dairy milk. So if you get IgE testing, and on the IgE testing, that's E like egg, you have positive reaction to dairy, then it is more likely that you have a more permanent, serious reaction to dairy. If you do what is now commonly exploding all over as doctors are starting to open their eyes and learn much more about integrative medicine, which is a good move, but a lot of them don't have enough information about the history and the structure of these items to really understand what has happened to dairy through homogenization and pasteurization. And they can't understand all this reactivity. It's really not to the product of the food, it's what's been done to the food. Nevertheless, your body may have what we would call sensitivities versus the allergies, and that's the IgG kind of a reaction, not IgE, the more anaphylactic hive type. So if you get tested, I would have the both immunoglobulin G, which is the sensitivity, and then you can subfraction it for the casein or the whey or the milk sugars like lactose. You can subfraction your sensitivity studies, or you can get the IgE to dairy, and that is in general a single isolated test that I'm aware of. Hopefully that answers your question, Tiziana. In America, I try and only use raw dairy that has not been heated and has not been pasteurized or shooken up, homogenized rather, is what I'm trying to say. And the goal would be not to have dairy every day, any food you have every single day, unless you're a pure carnivore and you're just eating meats. Then it's unlikely with meat on consecutive days that you would have food reactions. But we like to rotate foods. And if you had dairy that is not homogenized or pasteurized, and you did that maybe every fourth day, that should be tolerable, unless you have an IgE response. So hopefully that kind of helps you understand and what to ask your doctors in testing. Then Constance says, blessings. I was told that the HPV human papillomavirus could still be in my system and cause a 2-centimeter lump at my anus, even though I haven't had sex in 25 years. Really? Yes, the answer is viruses can be picked up from many sources. That's why you should wash your hands after going to the gym. You can pick it up with contact from the sweat. You don't even have to have sexual contact. So the touching and then rubbing of your eye and the mucosal membranes, maybe holding something and eating it. The human papillomavirus, I think, can last quite a deal of time, hours and hours on surfaces. So you can actually get human papillomavirus from many different sites. Very often a person might have a plantar wart or a tiny wart on their foot or an abrasion, and they're in the gym, they're walking, and the human papillomavirus is on the gym floor. That's why they tell you to use gym footwear, slippers, flip-flops. So it could be from something old, and your immune system with time or aging is dropping, and your immune system is acting more reactive. Now, a 2-centimeter lump is about just under an inch. I would have that checked out by your doctor. Let them see it. Let them do a cell scraping and see if it is HPV, and go from there. But do see your doctor on that. Deanne says, hi, Dr. Rita. Hi, back to you, Deanne. I had a gastric stomach ulcer 12 years ago. Do not want another one. Any suggestions to avoid another one? Drink plenty of water, and remember, your stomach is designed to have a very low pH to help protect you, kill bacteria, viruses, and things like this, like we just discussed. It could be we have taken in HPV and not known it, but our stomach acid killed it for us. So you can get your stomach acid down to a pH of 2 for sure. Some people don't achieve that. Usually the type A's blood types don't have the strongest ability to get a good acidic production of betaine hydrochloric acid, or hydrochloric acid, and they don't make enough digestive enzymes. So we do want your stomach acid to be robust, so that when you do eat, uh, it will trigger the secretion of digestive enzymes and acid. In between meals, it's very wise to drink plenty of water. Uh, if you're constantly nibbling on things, a grazer, your body is going to be secreting potentially squirts of acid and enzymes for which not enough food, especially if it's a starchy carbohydrate. And that could generate excess acid and digestive enzymes. So try and eat a good, strong, protein rich, good, healthy fats, limited carbohydrate meal. And then if you're a blood type A, please take digestive enzymes that have the enzymes and the acids, betaine hydrochloric acid. If you're older, if you're around age 60 or older, very likely you need to start taking digestive enzymes. We use orthomolecular here and we see very, very, very good results. A lot of people who are blood type A don't realize they're blood type A, and they'll be taking apple cider vinegar, and they will take that uh, when they eat or uh, early in the morning. Often they'll take that in prior to their breakfast, and they'll see benefit from it, from the stomach acidity from it. So long and the short of it is how to avoid another ulcer. Don't nibble on things throughout the day. Just have your set times when you're eating and don't eat late. The older we get, the less late we should eat. We should try and be done eating. The research is pointing to as early as 3 o'clock in the afternoon. I'm trying to train myself to not eat past 3 o'clock. I think I'm pretty much done by about 4:30 now. So I'm trying to eat breakfast and lunch or a later lunch, and that's how I'm trying to run my lifestyle. I'm trying, and I never nibble, and so this way, when your stomach needs to be used and acid secreted, there's a good bolus of rich protein and healthy fats for it, and then that's it. And then drink water liberally. Alexander says, I had a blood test and it shows I have parvo, fifth disease. I've noticed my cheeks have been red for a while now. What do adults with this do for it? I right off the hand, I would have to look up parvo in and of itself. Fifth disease. I recall, again, this is just 44 years back of training. So it's really almost 60, 50 years now. I think these are self-limited viruses. I think there is a parvovirus that's quite challenging in the veterinary world and damaging to animals. Whoever tested you is choosing to screen for that for a reason. Um, the universal antiviral agent is high dose vitamin C, either intravenously or orally, and the rate limiting step would be getting diarrhea. So I would certainly be using lots of vitamin C to bowel tolerance. I would use a rich protein and fat diet so that I could repair my cell membranes and avoid carbohydrates, sugar, starches, fruit sugars, because that will lower the immune system white blood cell phagocytosis. And I would take systemic enzymes to reduce the uh, damage to the blood vessels if there's some vasculitis associated with that particular virus. So I'm not an expert in uh, parvovirus in the adult. I would have to look that up. So I'm going to write that down. It's part of the wonderful thing about being a doctor and doing stuff like this. Parvovirus. So that I can learn more in the adult. So just really push as much high dose vitamin C as you can. I would tend to say buffered vitamin C. We have the capsules, 750 milligrams each, I think they are. And I usually take 4 a day, no matter what, just to tune up my mucosal membranes. And I have the high dose vitamin C drip here, 25, 50 grams. If your G6PD has been done, we won't give a 25-gram vitamin C drip if you don't have a G6PD done. But that would be a recommendation that I would take high dose vitamin C. Make sure your vitamin D level is up and your sugar content is down. Barbara says, I have a friend that had a estrogen driven tumor in her breast. Allegedly, she had radiation and now on Arimidex, causing depression and anxiety. Anything else she can do to counterbalance this? Thanks. When you say estrogen driven, you have to understand it's also glucose, starch, carbohydrates. So every piece of bread, every rice grain you eat, every fruit grain, some amino acids like glutamine are driving it, and lack of a good night's sleep and losing your melatonin is driving it, and lack of vitamin D, the fat soluble vitamin, lack of sunlight is driving it, and lack of exercise is driving it, and a stressful situation is driving it. And the insulin from the starch, bread, pasta, carbohydrates, nuts, seeds, crackers, bagels, tortilla chips, potatoes, yams, beets, all the carbohydrates will raise the insulin, which drives it. You have to know that these tumor markers are not doing tumor markers for insulin. There are, 10 to 30 times more insulin receptors for feeding a cancer tumor marker than there is for any estradiol molecule at all. So I think there was a question here. Barbara, yeah, Barbara, you had this on one of the questions here, and it said, what is a good way to counterbalance targeted radiation for estrogen driven breast cancer? So I repudiate the statement it's estrogen driven any more than it is carbohydrate starch driven or fruit sugar driven or insulin driven or all these lifestyle problems, lack of light, vitamin D, exercise, and so forth. The doctor prescribed Arimidex, which is a estrogen blocker, to take for 5 years. 2 weeks of it is causing her anxiety. So I would assume that the patient is somewhere in her perimenopause or early menopausal years, because when you lose your estrogen and block it like that, the brain calming, the sleep enhancing, the memory enhancing effects of our natural hormones suddenly ripped from us will create this loss and lack of memory, the anxiety from lack of a sharp memory, the lack of sleep, the exhaustion, the cortisol will create a catabolic environment, breaking down cells, which will promote the cancer growth. So this is no simple thing saying estrogen driven. That's kindergarten talk for metabolic mitochondrial processes that are driving cell metabolism failures that move a cell into a rapid, uncontrolled growth behavior. So there is a YouTube video called Cancer is a Mitochondrial Metabolic Disease. The mitochondria, of course, are the little energy cells that are in the packets, batteries, you might say, of every cell, and they make our ATP. When the mitochondria are damaged, and we can actually show you pictures of the mitochondria with its membranes that are invaginating into the mitochondria, they're damaged, they're lost, and the ability of that mitochondria to make ATP is lost. And so it must consume a lot of starch, a lot of fruit sugar, a lot of carbohydrate, glucose molecules from the starch to drive that injured, metabolically damaged mitochondria for the rapid growth of a tumor. Now, this requires studying. This requires hunkering down, going back to your biochemistry and organic chemistry, and go to the tricarboxylic acid cycle, Krebs cycle, and these pathways that are associated with these major complexes in the membrane of the mitochondria that pass electrons until energy is formed, a high-powered energy bond, ATP. On the cell membranes of these cells are receptors that are normally there. All normal women with breasts have estrogen receptor positive cell membranes. Every woman who is on natural hormone replacement therapy has natural, it gets a biopsy, will have their natural estrogen receptors there because this is normal. This is not abnormal. Just like there's insulin receptors to drive glucose absorption and glucose transporters and glutamine transporters and the metabolism of fruit sugars. These are all on the cell. So the question must be, what hurts this chain of enzymatic and energy transport across the membrane, growth promoting items that make the engine of that cell abnormal? Because you can take a cancerous cell and you can take the nucleus out of it and put it into a healthy cell. And that healthy cell will do fine, even though it has the nucleus of a cancerous cell. But if you take the mitochondria out of a cancerous cell and you put that into a healthy cell, then that healthy cell will become corrupted, become cancerous, and multiply. So let's get away from all this DNA gene concept. It's extremely overrated, extremely overfunded. And let's get into the hard discipline of exercise, going to bed on time, being on a low carb diet, not eating late, and getting some good sunlight and drinking a good amount of water, and getting a doctor that can do some good functional metabolic assays on you or anyone with this and help them metabolically. Now, here's another YouTube to watch. There's a whole series on this done by a bright young medical doctor called Casey Peavler, Peavler. Casey, Casey, Peavler, Peavler, MD, and he's in Florida. And if you go on YouTube and you put Casey Peavler, MD, you'll see him and click on his image and it'll take you to his website. I'm not sure of what his website is, but it has all these YouTube series on all these natural ways to repair and restore proper cell metabolism, even if you've been diagnosed with cancer. Hopefully that'll be a help to you. And then Adriana says, hello, Dr. E. What do you suggest for a uterine polyp? I have increased my progesterone and I continue to have heavy bleeding. I was also suggested to increase estrogen because it was low. Thank you. Adriana, your doctor needs to manage this. In general, we do a like a DNC, which is dilation and curettage. It scrapes the inside out and pulls that polyp out. We need to look and find out why that polyp is bleeding. Not infrequently, the increase in estrogen, getting a more robust estrogen to progesterone ratio does stop this bleeding, but polyps of themselves are behaving a little differently. So I would have your gynecologist seen. I would have them do a transvaginal pelvic ultrasound, and I would look for the thickness of the lining of your uterus. I would have them do a DNC to get that polyp removed. Then that should solve it. And work with a doctor who will check your estrogen, progesterone levels maybe once a month for 3 months in a row, just to make sure that there's no more bleeding and your level is stable. And do a follow-up transpelvic ultrasound in 3 or 4 months, just to make sure you're not building up on your current hormone replacement dosing or your own hormonal cycle, and then go from there. But be managed for this by your gynecologist doctor who can look at this and get that polyp removed. That's what I would do. All right, now let's go to some of these email questions. Barbara says, hello, I am an advocate for functional medicine, and when doctors go directly to a prescription and I want to check with you, this question is for my precious sister who is not looking to take medicines unless very necessary. Her concierge doctor looked at her recent labs, LDL, cholesterol, and HDL ratio. Doctor wants to put her on statins. When is it necessary and when not? I think if you do a sincere look at, and you can go on YouTube and get some good YouTube doctors and PhDs in this arena, probably the best one is by a Dr. David Diamond. And there's two other co-authors. One is an Australian medical doctor who is a sports medicine physician. Anyway, they did a very good retrospective meta-analysis of every cholesterol test that you can think of since it became of concern since the mid-20th century. They've also done up-to-date clinical studies on their patient population, and they come down with this situation. Even if there's that small percentage of people who may have some benefit, mostly as an anti-inflammatory, because statins will act as an anti-inflammatory, and that in a person who's already had their first heart attack, typically a male, then there may be some, and I'm saying may with a conditional, benefit to life extension, less death and morbidity. And when you look at life extension to those people who have had these high cholesterols and include those who are male who have had at least one heart attack, and you say, all right, they were added some statins, what is the expected prolongation of their life? I mean, they're only going to take it and spend, 10, 15, 20, 25 years, 30 years on a statin trying to extend their life, right? Well, shocker, it seems that there's only a few days of predictable extended life for all those years on a statin compared to working with a well-trained functional metabolic doctor who is going to see you frequently, weigh you, get your lean body mass, get your insulin level, your triglyceride level, your HDL level, your hemoglobin A1C, your fasting blood sugar. They're going to harp on whether or not you're doing weight resistance training, exercise for muscle resistance. They're going to talk about your life cycles. When are you going to bed? Do you have good hygiene in going to bed? Or do you have the lights on and watching videos? Do you get up in the morning early? Do you see the sunrise? Do you ground your feet in the wet grass for 2-3 minutes? Are you on a very low carb diet? Do you stop eating so that you'll have an empty stomach by the time you go to bed at 9 or 9:30? I mean, these are the things that made the difference. There's 3 things research around the world is seeming to agree on, and that is eating more like a carnivore, i.e. the converse of that is to be a very low carb person. Number 2, to do weight training. And number 3, stop eating around 3 o'clock in the afternoon. So there's a video called High Cholesterol is Healthy, and that's with a family YouTube doctor, Ken Berry, Berry, MD, and Dr. David Diamond, one of the authors of that paper, I can't remember the title too, that pretty much puts to bed the entire argument on statins. So have them watch it. Ask the doctor who's recommending this to watch it and be loving and supportive to the doctor. I mean, we all have to have a day of reckoning and learning ourselves. And like I said, I'm going to go look up the parvovirus. So to be a doctor, you're going to be a student all the days of your life. be teachable. So, high cholesterol is healthy. Watch that video. Watch the video on, uh, let's see, I can't think of that name. Dr. David Diamond will probably refer to the paper because he's one of the authors. So watch that. And that's what I would say about the cholesterol. So it's a very, very rare situation, I think, that you would ever need the cholesterol. But talk with your doctor, get informed, study the video, and let's everyone talk about it. Celeste says there's so much trending on social media about parasite cleanses. I'll say, Celeste, I'm getting up to my eyeballs in trying to look at all these items on parasite cleanse and these ridiculous, overbroad, sweeping statements. And unfortunately, we're all of the flesh, we all sin. And the lust for money, covered up with some modicum of humanitarianism, always seems to sell a lot of money. And the reason is parasites, the ivermectin itself, as an example, and that was the one that was suppressed by the corrupt medical system. So much for your PhD and Harvard College and Hopkins and Stanford and big name graduates. They are just following money and prestige, it would appear. But in general, the pathways, if you look on ivermectin, there are many good papers, and it got the Nobel Prize in 2015 for maybe one of the most beneficial molecules to the humanity. And there are 9 different pathways in which it inhibits abnormal cell growth unregulated to occur. And that has to do with the sugar metabolism, the glutamine metabolism, the many of these kinase receptors. These are types of receptors and enzymes that are turned on to promote certain growth patterns in a cell for its life cycle. And there's 9 just in the ivermectin. And there are many anti-parasitic medications that seem to have the ability to thwart or taper down uncontrolled cell growth. And so all of these statements about you've got a parasite, I've been doing this for 44 years. I'm on your side. I'm trying to bring the training and education of an allopathic physician in a standard medical practice, medical degree, MD, and bring to that knowledge base the training I also have in my other doctorate of integrative medicine that took me 2 years, in which many of the greats around the world, from Japan to Germany and all around, shared the medical benefits of the ancients. And I'm trying to balance both so that we aren't so allopathically minded, everything is treated with a drug potentially, to no drug is useful, to avoid them all, to the herbalist, and only do lifestyle herbs. So somewhere there needs to be wisdom and balance in this. And that's probably what I've been doing for 44 years. And there's errors on both sides. So this one, everyone's got a parasite, is erring on the alternative, complementary, integrative, functional medicine side. They're going nuts with saying that, trying to market something that is an anti-parasitic drug to get it into you. What we need are doctors who will accept their mantle of responsibility, and they will open their eyeballs and get some good studies done. Now, if you go to that Casey Peevler, MD on YouTube, and you'll see his face, he's a young looking man, wears glasses, he's got a crew cut, very nice man. He's about 40. And he has an entire series on ivermectin, fenbendazole, the multiple pathways I just talked about. They're listed out. I mean, there's hundreds of hours of YouTube and training that you could go down a rabbit hole with on him. And a medical doctor can look through this and see these, and so can you. It is not that hard for you to listen to the drift and the wisdom and the experience that he's bringing forth. And he's parroting a lot of what Dr. Thomas Seyfried, PhD, out of Harvard, I believe he's from Harvard, is saying about cancer is a metabolic mitochondrial disorder, a disease of the energy production of the cell. And that's from our high carb diet and inactive lifestyle. So, if you're going to say, what do I think about all the social media about parasite cleanses? I think they are ripping you off. And I've looked at a lot of their samples, and they have such a low amount of fenbendazole and low amount of ivermectin in their capsules. You would have to take probably 9 to 12 of them to reach a therapeutic dosing that is being perceived in all the anecdotal and research models that are out there, because this is not considered standard of care at all in oncological management of cancer. So I'm speaking from educational, informational. I'm not an oncologist, but there's an awful lot of reports of amazing turnarounds, along with immunotherapies, and that's targeting some of these enzymes like fructokinase pathways and other enzymatic pathways of the metabolic chain for energy production in these cells. And that's isolated immune therapies. So we can augment the power of the chemo, the radiation, the surgery, all of these therapies, hormone blockers, with adjunctive low carb, carnivore to very low keto diets, and these lifestyle and certain nutraceuticals that help to support healthy metabolism. So that's what I think about parasite cleanses. I have been doing this. I've been open. I've been looking for parasites for 44 years. And it turns out the big parasite is this big worm you see right in the picture here, with a mouth eating all the carbohydrates and all the alcohol and all the smoking and all the late night staying up. So here's the parasite. It's right here. It's us. All right. Now, what's next? The next one will be from Anarchy. Anarchy says, in addition to following the carnivore diet, what is your feelings about cheese, avocado, and coffee consumption? I have these items daily. Well, there you go again. Anytime you have something over and over and over and over and over, you're amplifying the likelihood that you'll develop a reaction to it ultimately. By the way, avocado is not on the carnivore diet. There are some modified carnivore diets that do allow the fats that are richer in the avocado plant. And so if you're pure carnivore, you don't have avocado or even coconut. Coffee, again, it's a stimulant. It will have some impact on glucose metabolism, maybe some of the shifting of your stored glycogen. Caffeine does have some activity that puts it at risk for being stored and having molds in it. So you have to get a very good, high quality bean if you're going to have it. So I don't see the problem necessarily with coffee, a good coffee that they try and screen for mold. The avocado I don't think is as wise. And cheese, you're probably not getting raw cheese. I hope you are. But again, I wouldn't probably have it but every fourth day. So those are my thoughts on that. And then earlier I went over the homogenization and pasteurization, and it really isn't dairy anymore. It's just an inflammatory food. We had another live question that says, a female relative is on a bioidentical hormone prescribed by her functional medicine rheumatologist. Well, I'm so glad to see specialists now moving into the world of functional medicine. It's about time that they're coming on board, and I'm very happy to hear that. When she told her allopathic gynecologist, the doctor was not happy that the rheumatologist prescribed this. Are allopathic gynos still against hormones? This is a 68-year-old. Unfortunately, I think they just don't have enough information or training. I easily put women on natural hormone replacement therapy. I'm in my 70s, even to the point where I have a menstrual cycle once a month, every month, a light one, but I still do. I would never stop my natural hormones, but I won't prescribe it unless that woman knows I expect her to drink her water, to get to bed on time earlier, get the light hygiene, shut the lights out, get up with sunrise, get some brisk walk in, some exercise every day. 20 minutes would be fine. Stand barefoot and get some earthing grounding to get your electrical anions, electrons uh, stabilized. The earth is a negative charge. And so if you take the standing in it, your wet feet will kind of equilibrate to your discharge, so to say. If you drink enough water so you don't get blood clots, everyone worries about hormones and blood clots, but that's really pertaining to the ancient original horse serum derived estrogen like way too powerful hormones. And go on balanced progesterone and take systemic enzymes. So if they're low carb, drinking water, exercising, getting a good night's sleep, good lifestyle hygiene with light and morning grounding and a brisk walk, some weightlifting, and they'll take the enzymes. I will start them at 90 years old. In fact, the 100-year-old birthday party I went to, she is still on her natural hormones, and she's still working for the Missionary Alliance missionary scheduling. Right, she does some work on her email for the missionaries. So, yeah, I'm going to always be on my hormones. And these dear gynecologists that don't know about this yet are just going to have to go to school on their own. It's not paid for. They got to put the hard work in. And pretty much when they get older as gynecologists, they'll start looking for it because as they age and wrinkle, they'll start looking at us who have been around 70, 80 years. And we're not so old looking and we're not so wrinkled. And they're going to start asking, why is your bone density normal? Why is your memory so sharp? Why do you not have cataracts yet in your 70s? Why? And they're going to start hearing about an antioxidant, healthy lifestyle with natural hormones, and they'll start learning. So praise the Lord. Just be gentle and share the good news with them, okay? All right, the next one we have is on the email. Let's see, it says, I wondered if you know if red raspberry is helpful during pregnancy. Oh, okay. I was told to take it many years ago in early pregnancy to strengthen the uterus, but to stop before the end of the pregnancy so that it wasn't too thick and would slow labor. Now it seems the opposite advice shows online. That's true. They're now some midwives are recommending red raspberry tea during their prodromal labor, Braxton Hicks contractions, things like that. But if you ask, is there a real scientific basis for this? I'm going to have to say the science is very, very limited. When I did the doctorate in integrative medicine, we had a lot of herbal stuff, a lot on natural hormones that act as natural estrogen-like modifiers that will not be a true estrogen. They'll sort of dock around the estrogen receptors, which will help mitigate the hot flashes, night sweats, and that kind of stuff. Red raspberry is considered to be in that category. There's no definitive science on that. It's more in the wives' tale and placebo anecdotal world than anything that has really been proven. So I'm not going to say anything. I would say it's much, much better to be well hydrated with healthy water structured water. Look up the video, Dr. Gerald Pollack, Pollack, Gerald Gerald Pollack, PhD, electrically structured water, and you'll understand why I'm saying that. Let's see, what's the next one? Lindy says, Hola, Dr. Ellithorpe. Hope you are well. Thank you. I am well. I've been researching creatine. I work out and walk every day. Started lifting weights. Wonderful. After my hand was healed post surgery. Please give me your opinion and dosage if recommended. Gracias. Lindy, yes, I am in favor of eating a very rich carnivore, protein rich diet in which there's tons of creatine in meat and chicken and fish and things like that, as well as collagen and so forth. So if you eat a high carnivore like diet, that's probably the best thing you can do. If you're blood type A, take the digestive enzyme. Now, it's not wrong to buy a high quality creatine. I'm looking into getting a creatine myself here because research is showing that women do, in fact, do better in building muscle, and your muscle mass is going to be your health reserve bank account to use for your muscle strength, getting up, cleaning yourself, individual daily activities of living. Uh, if you have good muscle tone. And creatine is very important in that, and many other things in your brain, in your memory, in your immune system, and so forth. So it isn't just muscle mass. Uh, the dosing would be somewhere in the realm of maybe upper limits would be 5 grams, 2 to 5 grams. And then research does show men have much, much more. And we're talking 90% more creatine in them than women do. So we are really behind the 8 ball. So yeah, I'm in favor of a very rich meat, fish, chicken, turkey, uh, you know, crustacean, lobster, crab, diet, and then supplement with 2 to 5 grams of creatine every day, high quality for sure. Brian says, hello, Dr. E. I'm recovering from a pneumonia with the help of antibiotics. Okay, this is my second infection in the last year and a half. In both cases, I went from 150 pounds to 140 pounds in a matter of 3 weeks. I don't smoke, and since the first bout, I've been following your health guidelines. Why the weight loss, and how can I avoid another infection? Thank you. Brian, I would see a good functional integrative doctor who can find out your blood type, your blood sugar level, your insulin, your triglyceride level, and your hemoglobin A1C. See what your serum protein level is, blood urea nitrogen, your albumin, globulin levels. These are antibodies. Of course, your differential on your blood count to look at your white cells, red cells, all these kind of things. Uh, find out what your lifestyle is, whether you live at altitude or your sea level, what kind of work exposure you've had throughout your life. Do you have heavy metal toxins that have built up in your bone marrow? Do you need EDTA chelation to improve the microcirculation, to get nutrition, fluid, immune components deeper microscopically through little capillaries all over your body? What type of exercise you're doing, what your protein level is. That's going to be known in your blood urea nitrogen, albumin, and globulin in your general comprehensive chemistry panel. What your thyroid activity is. Are you underperforming in your thyroid? What your testosterone level is, and conversely, it converts into estradiol. What your estrogen level is. What is your sleep cycle like? Do you have sleep apnea? Are you having prolonged episodes at night? These are all the things that you want to ask. We could do an antioxidant assay on you. We could give you iodine, which helps as a mucolytic and immune support. We could give you N-acetylcysteine, which is used prescriptively in a thing called Mucomist to help lung function. We could talk about natural expectorants, natural antihistamines, high dose vitamin C immune drips to use. I mean, what is your vitamin D level? A good doctor is going to put that and more all together in a visit with you. So I would work on that, and I would start with some good vitamin C immune drips, because the universal antiviral antidote for toxic exposures is high dose vitamin C drips. And then we'll have to do some resistance training and look at your protein levels and muscle mass to see how that's going. Tiziana says, any thoughts on tart cherry powder to promote sleep? Tart cherry powder. Well, cherries are often used to impact the metabolic biochemical pathways that are associated with gout uric acid formation. Now, those are inflammatory promoting pathways, uric acid. And if cherries do that, we know that therefore there are inflammatory molecules that can irritate the brain. And therefore it could be construed to have some benefits neurochemically, to be a calming agent by reducing the inflammation for your brain. So I would have to look into that. I'm going to have to write that down in my never-ending lessons here. Powder, cherry powder for sleep. Tiziana. Okay. So I'll look into that, but I know, I don't know the name off my head of the biochemical molecule that's involved in the metabolic pathways of uric acid. It is in those phosphofructokinase pathways, especially with a high fruit sugar diet, but there are other ways to do it, and that's inhibited with cherries. So yeah, I can see how it would be a benefit. But catch me on that next week, and I'll put this on my to-do list. Garden Fury says, hi. Have any of your patients on levothyroxine noticed any possible issues with different makers? My latest refill is a round pill, and I have gained weight. Diet hasn't been great, though, lately. Garden Fury, in general, there are standardization of the manufacturer of levothyroxine, which is T4. And the dose amount per pill or capsule is well regulated. So I'm going to say, no matter the size or the shape of the pill, the dosing micrograms, if it's 25, 50, 75, 100, 88, 150, 175, whatever it is, these are standard. So I'm going to say no to that, and probably more activity and diet. The next one on here is Jennifer says, I got an EKG and a SOI CT cardiac CTA coronary CT. That's a coronary artery CT of the chest with a dye. And they're trying to look for plaque in the coronary arteries in the CT exam. So it's looking for that calcium plaque to inhibit the little X-ray beams that will show the calcium deposits. And they do it with and without dye to get a better contrast concept of maybe some soft plaque as well. All right, it came back normal. Well, wonderful, it came back normal, but my echocardiogram shows a small amount of fluid around the heart, aka mild mitral valve leakage. Now listen, I don't know your situation or who you are, Jennifer, but I'm telling you, in 44 years of practicing medicine, I'm telling you, almost every report I ever see on anyone now, 15 years old and older, since the shot for the mRNA for SARS-CoV-2 was foisted upon the human population, and even teenagers were getting inflammatory myocarditis from it, which they knew before they let it go, by the way. I have always seen them talk about the radiologist reading it as mild mitral valve prolapse. Mild, aortic leaflet valve sclerosis, mild this. You know, I have never ever seen them say, "Oh, this is a perfectly great cardiac exam." Not once, ever, in 44 years of seeing them all. So, do I think mild mitral valve prolapse leakage is significant to your life and longevity? I don't know the individual situation, but I'm just telling you, it certainly doesn't impress me when I've seen almost everyone have some prolapse and mild leakage come back. So, if you've had a normal coronary artery CT with no real evidence for any plaque, and only mild mitral valve leakage, I would not worry at all. Follow up with your cardiologist, discuss it, and say, why does Dr. Ellithorpe always hear the radiologist report mild mitral valve, tricuspid valve leakage? Because if you're a carpenter, everything is a nail that needs a hammer. If you're a painter, everything needs a new coat of paint. If you're a radiologist, cardiologist, everything needs your repeat echo to make money and repeat visit. I'm sorry, unless you get some hard reason that there's anything of concern, um, I'd be very cautious for just endless repeat studies unless you have some symptoms. But again, I don't know your personal situation. Most everyone who has this is just fine, in my personal experience, with just mild mitral valve prolapse. Carrie says, my 85-year-old dad had a catheter inserted due to enlarged prostate. Is there anything you can do to straighten his bladder for post catheter? Well, you got to work with your urologist on that. He loves plain coffee, uh, but they said caffeine irritates the bladder and prostate, and you shouldn't do more than a cup a day. I agree with that because it's a diuretic. It'll increase the urine flow to the bladder, put more strain and stress on it. It is has some neuromuscular smooth muscle, I think, to the detrusor muscle of the bladder. So caffeine is not your friend with prostate benign prostatic hypertrophy, pinching off the tube of the urethra. I would have them get his testosterone and his estradiol level. If his estradiol level is high, and you Google estradiol and benign prostatic hypertrophy, you'll see 1,000 papers that estrogen will raise the BPH, stimulate the benign prostatic hypertrophy, and therefore he could take an estrogen blocker like the Arimidex, an anastrozole. Talk with the urologist. Be on a very low carb diet so growth is not stimulated. Use systemic enzymes. Exercise, do weight training if he's able to do that. Those are the things I would advise. There are those who have argued, and I have anecdotally seen raw, unroasted pumpkin seeds chew 20 raw pumpkin, no, not 20, 2 tablespoons of pumpkin seeds, 2 tablespoons every day, and that tends to have a beneficial effect. Systemic enzymes. Don't drink alcohol, that'll swell the prostate because alcohol will make estrogen go way up in a man. Be on a low carb diet, those kind of things. Patricia says, what are your thoughts on taking fulvic acid supplement? I'm not against it. Where do you get it from? It's in the forest, on the ground. Fulvic acid is part of the fungi breakdown product of the leaf and everything. So it has value in nutritional return of minerals and to the ground of the earth. So of course I'm for it. Is there strong evidence that fulvic acid is key in certain metabolic and symptom complexes? Not so sure about that. So that's my thought on that. And the last one is, hello, Dr. Ellithorpe, can EDTA chelation remove certain medications from the body? I've never seen that. Or make certain medications less effective? I've never seen that. Specifically, the targeted chemotherapy drugs, Tafinlar, 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 or Mekinist, Mekinist. Those are targeted therapies. They're not really chemotherapies. They're immune therapies targeted on blocking certain enzyme pathways, I'm sure, especially those fructokinase pathways that are very involved in skin cancers, typically other cancers, many cancers you'll find out, because phosphofructokinase enzymes have to be working right in all of our mitochondria. And they're finding certain cancers by blocking that activity to deny the cell its energy. They're getting great responses as well. So no, I've never seen chelation therapy do anything but help. Did I get anything else? Marlena, let's do these last two and then we'll be done. Let's see. Garden Fairy says, in Dale Bredesen's book, The End of Alzheimer's, he states to be careful of probiotics if someone has a leaky gut. I had never heard of that before. Yes, I've heard of it. But what are you going to do? Anything's leaking through there anyway. And everything you eat has bugs and bacteria and viruses on it. I think, you see, you can make yourself sound so informed to the point that you're no earthly good. So, yeah, I think lactobacillus, these type of things are valuable. If a person is otherwise with a reasonable immune system, I think it's very fine to use. I think that's going overboard in my personal feelings. Mariella says, I have hypothyroidism and take NP thyroid 90 milligrams. Now I have Hashimoto's. Do I have to adjust my medication? Well, Hashimoto's is an autoimmune attack on your thyroid that you've generated, your self attack on your thyroid, which tends to make the thyroid activity higher, and you may not need NP thyroid for much. You have to talk with your doctor and see where you at in this diagnosis and what your levels of your thyroid antibodies are, and have that managed individually with your doctor, Mariella. Jackie says, do you feel that a hysterectomy causes belly weight gain? The answer is no. I am 63 on hormones. It's been 1 of 5 years. It's been 1 of 5 years. I don't know what that means. 1.5 years, okay, since the hysterectomy. No, there's all kinds of reasons why we have to get hysterectomies. I don't know your age. No, wait a minute. You said you're 63 and you're on hormones. Yeah, there are far more age-related cortisol stress, and surgery itself is a stressor. So the cortisol is a thing to hold on to weight. So work on your exercise, your relaxation, your good night's sleep, getting up early in the morning, be on a very low carb diet, those kind of things. Work with a good functional doctor. And with that, I am going to get to my homework. Parvoviruses and cherry powder for sleep. So maybe next week I can do that, and I'll see you all. God bless. If you like and this is helpful, please like and subscribe. Please share, and please help the channel out with a like and a subscribe. God bless, and see you 6 o'clock next Tuesday. All right, bye-bye.